My name's Sonia. I am a family doctor in London. I'm currently interviewing family doctors from across the world to find out what their day-to-day experiences of managing COVID-19 is.
So I'm Dr. Pratyush Kumar. I'm just senior resident working at Patna Medical College, and I'm interested in rural health and currently chair the rural health group in South Asia, known as Wonka Rural South Asia.
Just to start sort of simply, what's your testing criteria at the moment?
For the testing criteria, it has gradually evolved from when we started the COVID-19 pandemic
Mhm.
until now. Initially, it was only those people who have come from abroad and all those who were in contact with them.
Mhm.
Then all the health professionals who had symptoms, they were also included in the criteria.
Oh, wow.
Now, now the fourth criteria which have been added are that any patient who have got severe acute respiratory illness or symptoms suggestive of atypical pneumonia, they can also be tested.
Is it easy to find the tests?
Test is available free of cost by government is doing by free of cost. Those who meet the criteria, they have to visit the government center
Right.
and they are getting isolated and then the testing is being done. But from past some 7-10 days, many private labs have also been approved to conduct these tests. So they are doing at something around, they charge around, maximum they can charge 4,500 rupees because to do these kind of tests, the government has put some criteria. They should meet the criteria biosafety level,
Yeah.
then only they can perform these tests. So like not all the labs can do, but there are some labs who are doing it. But at present in Bihar, there isn't any private lab who are doing these kind of tests.
Is it quite rural or is it quite urban?
Just around 60 to 70% of our population are rural.
That's quite a lot, actually, isn't it?
Uh, and with rural, we should also understand problems associated with rural communities. And the
Mm.
most important is the access to healthcare.
Mm.
Access is key to healthcare. And here, because of lockdown, that access is greatly compromised.
Mm.
People are finding it difficult to reach hospitals because they know public transport is not there, and uh, existing alternative arrangements are also very difficult. Yeah, plus we have got huge migrant population.
Mm.
So with migrant population, and they are coming back home in large numbers. Okay, so around lakhs and lakhs of people are coming back to Bihar from different states because usually they go to other states where there's a good number of industries are there. They go out for jobs, and nowadays suddenly there is lockdown. People are finding it's difficult to meet their daily demands like
Mm.
food, shelter. So they're coming back home, and when they're coming back home, there is risk that they may come with disease and it can further spread within communities.
Mm.
So government is trying to deal with these kind of issues.
Because I can imagine that's quite challenging because my understanding is that a lot of the migrants or kind of working population are, they only get money if they're working.
Yeah,
So if they aren't working, for example, during lockdown, they have no income at all.
right, right.
Like I can imagine that's quite, I mean, that's a very difficult position to be in.
Exactly. Like we must understand that not everyone has got a permanent job where they can sit and they can get a salary.
Right.
Most of our population are daily wage laborers where they work in construction, building construction, or they work in industry, or they have got some daily jobs
Mm.
where depending upon the work they do on a daily basis, they earn money.
Mm.
So if we put them in a 21 days lockdown, it might be difficult for them to even feed their family.
Mm.
So we also should understand about the socioeconomic impact of COVID-19,
Yeah.
apart from the impacts of COVID-19. And the socioeconomic impact had made our rural population much more vulnerable. They already suffered from gross inequities over the period of many years.
Mm.
And now COVID-19 has just exposed their vulnerabilities like malnutrition, ANC checkups, immunization, that maternal and child health care, and the non-COVID-19 cases like stroke and other comorbidities, people are finding it's difficult to get medicines, and the diabetic patients are finding it difficult to get insulin.
Yeah, that's
Similarly, for other illnesses.
because actually I hadn't thought about that, because if you aren't receiving an income and you can't pay for your medications for your non-communicable diseases, then you're at a
Yeah.
higher risk of, as you say, kind of heart attacks, strokes, things like that during a time when there's not enough hospital space because everyone is focusing on COVID-19.
There's always a risk that if we allow everyone to come to mix within the hospital, then
Mm,
the hospital case transmission would increase. But at the same time, government is also trying to find some alternative means.
mm,
For that, like they have earmarked a hospital as COVID-19 hospital exclusively for that. So that will prevent hospital-based transmission.
okay.
They have started a separate flu clinic, like fever clinics, like
Mm-hmm.
all those coming with fever, they go to the separate clinic where they have made proper arrangements for with PPE and other requirements which are necessary to prevent some transmission. So these are small initiatives being taken by the government. Those who are in rural areas, they are finding it difficult to get at least they get the medicines done.
Mm,
Like the most important medicines like TB, blood pressure, diabetes. These are some of the very important medication. Without that, they can have many complications.
mm.
So now they are finding it difficult.